cost of healthcare appears to be giving people a financial headache.
There's a lot of anxiety when you go to the doctor about what you are going to pay.
What is really going on with healthcare costs?
Why do you think people are so mad about the health insurance system?
Americans spend significantly more on healthcare than any comparable country or OECD nation. Yet, we have the lowest life expectancy among them. The impact of rising healthcare costs is widespread. Over the past 2 decades, health insurance expenses for working-age Americans have increased nearly 3 times faster than wages. According to the Consumer Financial Protection Bureau, healthcare bills are the leading cause of personal bankruptcy, with medical expenses making up over half of all consumer debt in 2022. Harvard economist David Cutler points out that we spend more on administrative expenses than treating major health issues like heart disease and cancer. Public anger over high costs and poor results have been squarely focused on the health insurance industry in the wake of the assassination of UnitedHealthcare CEO Brian Thompson in Midtown Manhattan on Wednesday, December the 4th, 2024. Massachusetts Senator Elizabeth Warren urged that the anger reflects a broader discontent with the system, as many feel cheated by their insurers. However, economists argue that the entire healthcare system deserves scrutiny. According to Rice University economist Vivian Ho, insurance companies made $25 billion in profit last year, while hospitals earned a staggering $90 billion. Vivian also remarked that it was clear how angry the public is about healthcare costs, urging that this anger should also be directed at hospitals, many which are nonprofit. So here on the Matter of Factx, we will show you 7 key reasons why healthcare costs in the United States are significantly higher than in other countries without achieving better outcomes. U.S. hospitals have more specialists than other countries, contributing to higher costs. The availability of 24/7 specialty care, particularly in metropolitan areas, increases costs. In 2022, hospitals accounted for 30% of the $4.5 trillion spent on healthcare in the U.S. Most hospitals are nonprofit and receive tax breaks. Still, many do not fully meet their obligations for charity care. Research estimates that nearly 3,000 nonprofit hospitals avoided $37.4 billion in taxes in 2021, while providing only $15.2 billion in charity care. Proposals for healthcare price caps could help control these escalating costs. Healthcare providers in the U.S. are paid for the number of tests and procedures they perform rather than patients' outcomes. This fee-for-service model incentivizes quantity over quality, as providers earn more regardless of a patient's improvement. Although value-based care models have been introduced since the Affordable Care Act in 2010, their adoption has been slow. Out of 50 models launched by the Center for Medicare and Medicaid Services, only 6 resulted in savings, and just 2 showed quality improvements. Specialists like cardiologists and oncologists receive significantly higher payments from Medicare and private insurers than primary care doctors. This creates a system that rewards specialists for managing complex conditions while undervaluing primary care providers focused on prevention. The American Medical Association has a committee that recommends payment values for services, which Medicare uses to set compensation. Critics argue that this allows doctors to influence their pay, leading to potential conflicts of interest. Medicare payment rates not only determine how much taxpayers shell out for older Americans, but also pricing across the healthcare system, as private insurers offer mirror these rates. Reforming compensation to better support primary care could enhance health outcomes and reduce specialist costs. Administrative expenses are a significant source of waste in healthcare spending, with estimates suggesting they account for up to 25% of total cost. Health insurers often require doctors and hospitals to get an authorization before performing procedures or operations, or step therapy, which makes patients try comparable low-cost prescription drugs before coverage for a doctor's recommended drug kicks in, creating additional administrative burdens for providers. Despite advancements in digital records, many systems struggle to communicate effectively, leading to complicated authorization processes. Improved electronic access to patients' records could simplify these tasks, but may still rely on outdated methods like fax machines. Medicare operates more efficiently than private insurers, allowing for more straightforward billing and payment collection. However, this efficiency can also facilitate fraudulent billing within the federal health program. Many patients are unaware of the cost of tests and procedures before visiting clinics or hospitals. Healthcare prices are often hidden, making it essential for consumers with insurance to understand these costs, as they typically cover a portion of their bills. For instance, an MRI can cost between $300 and $3,000, and a colonoscopy can range from $1,000 to $10,000. Economists have urged Congress to pass the Healthcare Price Transparency Act 2.0, which will require hospitals and other healthcare providers to disclose their prices. The first Healthcare Price Transparency Act law, enacted during Trump's administration and continued under Biden, mandates only hospitals to disclose prices and negotiated rates. Still, the report indicated only 21% of hospitals fully comply with the existing federal price transparency rule, down from 35%. According to a 2023 HHS report, U.S. prescription drug prices are more than 2.5 times higher than in 32 other comparable countries. For instance, the median annual cost for 224 drugs approved by the Food and Drug Administration from 2015 to 2020 was $196,000 annually.
Novo Nordisk charges Americans with type 2 diabetes $969 a month for Ozempic, while the same exact drug can be purchased for just $59 in Germany, $122 in Denmark, and $155 in Canada.
During a hearing, Senator Bernie Sanders highlighted the significant price differences for drugs like Ozempic, which costs $969 a month in the United States. In contrast, the same drug costs $155 in Canada, $122 in Denmark, and $59 in Germany.
The CEO of the nation's largest private for-profit hospital chain is under fire for ignoring a subpoena to testify before the Senate today. The hearing looked at the financial collapse of Steward Healthcare. That's a hospital group created by a private equity firm, generated huge fortunes for its investors and its CEO, but left patients in dangerous, sometimes deadly conditions.
Private equity firms have increasingly acquired hospitals and large medical practices, focusing on profit. The bankruptcy of Steward Healthcare illustrates this trend. Steward Healthcare was formed in 2010 when a private equity firm acquired a financially struggling nonprofit hospital chain from Archdiocese of Boston. The chain is led by a former heart surgeon who collected over $100 million in compensation and bought a $40 million yacht. Staff reported shortages of basic supplies, leading to the layoffs and closures. Private equity investors also have targeted specialty practices in certain states and metro regions. The FTC has sued U.S. Texas-based Anesthesia Partners for violating antitrust laws through acquisitions that raised patent prices. FTC Chair Lena Khan noted that these transactions allow executives to profit at the expense of patients' care.
We start right now with those new developments in the manhunt happening right now for the suspect behind the killing of UnitedHealthcare's CEO.
Recent events, including the tragic shooting of an insurance executive, have drawn attention to the flaws in the U.S. healthcare system. Andrew Whitty, CEO of UnitedHealthcare Group, acknowledged these issues, stating, "We know the healthcare system does not work as well as it should, and we understand people's frustration with it." Hey everyone, we reached the end of the video. Prior to the video, did you know about the 7 reasons Americans paid more for healthcare than people in comparable countries? Do you think the United States should adopt a single-payer system like many other OECD nations? Share your thoughts in the comment section below. And until next time, take care.